and it's important for us also to be informed so that we can be more involved in the issues that relate to us being Filipinos or even Filipinos in the Philippines. I'm talking about Medicare portability. We've talked about this before on the show, but we're going to be discussing it further here today. Our guest is Eric La Chica, organizer of the U.S. Medicare Philippines campaign based in Washington, D.C. Of course, he is familiar to all of us because he led the successful lobby efforts there for Filipino veterans over the past decade. Hello and welcome to Kababayan, LA. And Mang Franco Arcebal is, of course, one of our beloved lolos who also fought for equality for Filipino-American veterans. Now, that is behind us. We're very happy with the results. You are very happy with the results. And now we have another fight in front of us. Eric, can you tell us about Medicare portability?
Yes, there are so many Filipino-Americans and Filipinos in America who are reaching the magic number of 65, the golden age. Actually, about 100 turn 65 every day here in the United States.
Every day?
Every day.
Wow, okay.
Part of the tsunami of retirees, about 10,000 turn 65 every day. So we have a big challenge kasi yung ating adopted motherland, the United States, is facing a fiscal crisis. Medicare is going broke. We have to find solutions. And Medicare portability will be one solution to the cost of providing health care to our elderly.
Right. Let's talk to some of the retirees. Mang Franco, I know you're one of them. You've lived most of your life here in the U.S. after the war and all that. But why is it important for our Filipino retirees to want to go back to the Philippines? Would you want to retire there?
We are Filipinos. We cannot remove that blood from us. We are very close to our families. That is why we want to go home. Some of us, not all of us, we want to go home because we want to enjoy the Filipino type of living.
And that is where Medicare portability comes in. Because many of you, especially retirees, when you go there, you deal with a lot of illnesses.
And the widows. I have, and there are many of us who goes there to the Philippines every year. At least once a year, we go home.
And that is a good point, Mang Franco. Eric, not just retirees who live there. Sometimes these balikbayans, they go there for vacation and then they get sick there.
Exactly.
What happens?
Well, right now, Medicare will cover emergency room care na lang, so we're trying to extend it for long-term care, for those who have going to spend a long time in the Philippines. Kung magkasakit doon, covered sila. And just on a personal note, I'm doing this because on the memory of my parents, they would have retired in the Philippines 20 years ago kung merong Medicare doon, may benefits. And recently, one of my close family members became disabled.
Okay.
And she wants to retire in the Philippines. And people don't know, Medicare goes down to age 55 kung disabled ka. So many of our Filipino Americans who are disabled, age 55 and older, can go to the Philippines if portability is extended.
Kasi right now, they are forced to stay here para magamit nila yung Medicare nila dito.
Exactly.
And this is sort of like a win-win situation because also, yung America, it says here, Medicare will run out of funds in 12 years, according to the Medicare Board of Trustees, and may lead to widespread social unrest. So, if Medicare is accepted in the Philippines, which is, of course, we all know, cost is cheaper, makakatipid ang America. We can help save America more than $500 million a year, correct? And where are we getting these figures?
Yes, we're using a cost estimates done by researchers, the University of Austin and Texas, and comparing the current cost in the Philippines for heart bypass operation, kidney, knee surgery. It's about 1/3 the cost of the American hospital charges.
Only 1/3.
1/3.
Kaya. So makakatipid talaga.
Oh yeah, at minimum 50% savings.
Okay, they say though, but playing the devil's advocate here, the American government might not want it because of two reasons. Mainly, right now, no? Number one, yung involvement nating mga kababayans. Unfortunately, maraming mga Medicare fraud, mga insurance frauds, and there have been some Filipinos involved in that. So I suppose a concern is if it goes to the Philippines, how can we police that it's really being used appropriately and appropriated accurately instead of fraud, or it being used as for fraud?
Yes, two questions. First of all, this has been done already. Portability exists for certain Americans, especially those who live in Guam, because it's a U.S. territory, they're U.S. citizens. Pinayagan sila since 2006 to go to the Philippines and have their medical bills paid by Medicare.
Right.
Bakit hindi tayo sa Amerika? Those who are here in mainland USA who retire, why can't they avail of that? The same thing as their Guam, colleagues.
Right.
So ngayon,
bakit daw? Why nga?
Because
Ba't hindi tayo kasama?
quirks of the law, you have to be closer to the top hospital than they're closer to the Philippines than to Hawaii. So there's little quirks in the Medicare law.
All right. And that is what we're trying to change now. Add a little bit of revisions or extend dito sa Medicare law na to. We're going to be discussing this a little bit more when we return on Kababayan LA. Don't go away.